Hello, this is Dr. John Makoff. I want to talk about a case I have going on actually with a patient, and he was referred to me for abdominal pain that has been going on for over 10 years. And right side abdominal pain, lost a lot of weight over the years from different diets, not being able to eat certain things, or his diet getting more and more limited from what he could eat without having pains. And he was referred to me by a colleague in Houston. And so we worked through things. And he said it originally happened soon after he was put on some antibiotics. And he's been to multiple doctors over these 10 years, clinics, various GI specialists. Nobody's found anything, and it just keeps getting worse. And he's like, you can see his ribs, tall and very skinny person, and in his mid-40s. And so we worked through things and went through looking for hidden infections. We went through looking for different chemicals, heavy metals, food sensitivities, hormonal issues, blood issues, all those things. And we started finding some herbs to put him on. And we went through a few different rounds, and it just actually started getting better and better each round over the last few months. And because sometimes your body can only handle working through certain issues at a time, you have to give your body the energy to focus on what it needs to focus on first before the next round. So sometimes even we using some broad spectrum things that affect the viruses, bacteria, parasites, fungus, but sometimes you need some things that are very targeted, but the body also needs energy to deal with it. So you can only give a certain amount, and then you see what the next layer is, and then work off of that. So last week he came in and didn't look so happy, and turns out his wife's birthday was the last weekend, and tried some wine, just a little bit, tried some tiramisu, just a little bit, had some Italian food, just a little bit, had burger with bun and gluten and just a little bit, and all these little bits added up, and he felt really bad after that Italian food. He's like, well, I was feeling so good, it's, I don't know why, and he just looked really down afterwards. And I had to explain to him, and that a lot of people also have to understand, is just because you're feeling better doesn't mean everything is done, doesn't mean everything is back to normal. It takes 30% of the symptom or the things going wrong for you even to feel symptoms. And depending on how in tune you are with your body, it might be a little bit more, it might be a little less. So just as if you had a sprained ankle, just laying on bed and not feeling it doesn't make it better, so you could just go running off. You're going to injure yourself, or you'd be in a lot of pain again. So we went back, and we just needed to recalibrate, and said it's a learning lesson. And it's to say, okay, we need to, we've been through this for 10 years. You can handle a little bit more to just, stay on track and eat what you can eat. And we go through the sensitivities again, get him on the new herbs that he needed. And, he's back in it, but it takes a little time. And sometimes, depending on the issue, it will take some time. And just that initial part of feeling better doesn't give you the license to just do whatever you want. I mean, you can, because it's your body, you can choose, but realize you may pay for it later. And if you're okay with that, that's fine. But, when you're on the healing path, you sometimes have to stay on the path even when you're feeling better until it gets all better. So hope that helps some other people keep on the path they need to keep on. And If you have any questions or comments, please leave them below. And hope everyone's doing well, and we'll hopefully see you later.